There's so much going on now that we're able to get the COVID-19 vaccination. It's so exciting, but also a little scary. So here with 5 things we need to know before and after we are vaccinated, we welcome to the show, back to the show, Dr. Ernst. You back.
Thanks for having me, Kara. How are you doing?
Good. You know, many of us, I'd like to say, over half at least right now in Oregon have been vaccinated. So we're kind of focusing on 5 things today that you need to know both before and after, just about these COVID-19 vaccinations in general.
Well, I mean, the main thing is, and the main question we are hearing every day now from patients is, how come that some people who have been vaccinated still are reported to get COVID? And how come that some, like a week ago, a famous fashion designer, for example, could even die of COVID after he was vaccinated? So in order to understand that, there's a couple of things, of course. One is there is no such thing as a 100% protection. We know that from the get-go. And the studies have shown, dependent on the type of vaccine, an efficacy of 60 to 95% in preventing severe disease, hospitalization, and death, but not 100%. The other thing to keep in mind is, of course, people might have contracted the virus even before they get vaccinated. So there's a latent period of maybe 2-3 weeks before they appropriately develop antibodies. And there's a latent period of at least 10 to 14 days before the virus can cause symptoms. So some people might be just within that time frame, having had the virus without symptoms, getting vaccinated, and then getting sick before immunity is really achieved. Another point, of course, is the mutations, and we are all scared of those, especially what we are seeing in India now, the triple mutant variant. And it is not clear at this point how much and if the currently available vaccines are effective. Most likely they are, but mutations are mutations, meaning that can change from a day to another, from a week to another. So only time will tell and can tell us if the vaccinations are effective and or if we have to do booster vaccine shots or even annual shots in the future. We just don't know yet.
For those who have already had COVID-19, not the vaccination yet, why are they being encouraged to have the vaccination?
For those who had COVID, they have natural. However, the amount of antibodies is not sufficient. The vaccine, in some countries, people even say maybe sufficient rather than 2, but you get definitely a stronger and longer lasting protection than from the natural antibodies as a result of the COVID infection alone.
We're looking now at kids 12 to 15-year-olds being able to now get the vaccination. Can you speak to that age group and what we're finding out?
For a while, we knew that children or young adults all have very mild symptoms, but for a while we thought they might be super spreaders without even knowing it. So kids can have the virus and might not get sick from it, meaning no symptoms, no hospitalization, no significant risk of death, but they still, by carrying the virus, could transmit that virus to their household, their elderly at home, their grandparents, for example, who might have a weaker immune system, and then they could be at risk of death. So in order to create herd immunity, we want to get as many people vaccinated as possible, including young adults, adolescents, and I'm actually glad that the 12 to 15-year-olds can get now the vaccine, the Pfizer vaccine.
Can we speak about the future of this vaccination? Is this something where if you were vaccinated last January, you have to think about this coming January getting revaccinated?
Well, people are talking about right now, there's really no study data around now because so far we have less than a year of experience of COVID, or a little more of a year of COVID, and less than a few months of vaccination. The main real world data are coming now from Israel, where we see how effective the vaccination is in general outside the frame of clinical studies. But we just don't know. Only time will tell. But I expect that most likely we have to anticipate booster vaccinations, possibly annual vaccinations in the near future.
And even if you've had the vaccination, if you're still seeing symptoms, is this something where you should for sure go in and get tested?
Oh, absolutely. I mean, again, the risk of getting COVID after vaccination is very low. In the Pfizer study, it was 0.48% of the total vaccinated people get COVID infected. But there is a possibility. And if so, of course, the disease needs to be treated. Even though we don't have a curative therapy, we still want to do what we call symptomatic and supportive therapy. So the answer is yes, get tested.
Thank you so much, doctor.
Thank you, Kara, for having me on.
Yes, absolutely. We're going to have more information about today's segment and about Dr. Ernst on our website, katu.com. Don't go away. We'll be right back.